other endocrine problems and problems like Mary Beth has, you can see that weight is probably not an issue there. And I have quite a few people that we work with and know that have PCOS that maybe are the same size as I am. Okay, so just looking at a person, you can't tell what's going on. And that's really important, that every time you sit down and think about a baby, you write down everything that you need to ask, everything that's been a problem for you, everything that you need to know. And many times your OB will not be able to help you with that. Okay, so say, who can? That's part of that reproductive life plan. What can I do about this? What if that was a problem? Tell me where to go. Tell me what to do. And you can talk to us too as well, but you can see that obesity and women's health and obesity and pregnancy are dramatic problems for the rest of your life. And I think as women, we all struggle with this. We struggle with it whether we're too thin or whether we think we're too heavy, whether, you know, nobody ever says, geez, I'm so glad I'm this weight. You know, and I know for you guys it's just really frustrating, but it's the way it's encoded into our DNA or something, you know, that we're always concerned about this, but we never ask a health provider, you know. We go on the website and we find this and we listen to TV and then we listen to these infomercials. Get to a healthcare provider who can help you with that. And there are special people that do that called reproductive endocrinologists, okay? And you need a referral from the doctor for that, but for the most part, your insurances and Medicaid will pay for that. Obesity has been implicated in some prematurity, but not all prematurity. And many of the things that it says here, glucose intolerance, pregnancy-induced hypertension or high blood pressure in pregnancy, blood clotting and so on, neural tube defects, premature birth, most of them are basically due to the fact that they predispose you to diabetes. You know, and having that strange shift of sugar during pregnancy is interesting. So interesting that in a diabetic mom, when the sugar is really high in the bloodstream and the mom is pregnant, that is considered a teratogen. Do you know what a teratogen is? That's something that causes birth defects. Be like radiation or something like that. Is that high level of blood sugar. And in women who don't utilize or convert sugar correctly, some of the birth defects that we're looking at are things like neural tube defects, cardiac defects, and so on. Basically, it's one of the things that we want to look at and make sure that it is appropriately handled. The same is true for being underweight. Oftentimes women who are underweight don't produce enough hormones, specifically progesterone, to carry babies to term. So you need to know what your ideal weight is, and they do that based on a basal metabolism. And a nutritionist will do this for you. And when you're going for your pre-pregnancy checkup or whatever you're going to call it, if women are seen once a year, say, I need to see somebody. You know, I really do. I need to see a nutritionist. And you can get those referrals. And I don't think anybody tells you that. In medical school, in nursing school, we get a lot of this. But in medical school, you don't. You're seeing more and more of that. But your OB may not be the person that can answer some of these questions for you. It may be a nutritionist. It may be the nurse practitioner in their office, and so on. But unless your friend is a nutritionist, they might not be able to give you the right advice too. We're always amazed when we're talking to folks that have had early labor. They said, we asked, what did you do first? Well, I called my girlfriend, or I called my mother. So we've actually made a brochure. It says Girlfriend's Advice on Preterm Labor. And we've done one on breastfeeding and whatever, the Girlfriend's Guide to this stuff, because the healthcare provider is not the first one to call. And as a healthcare provider, that too may be our fault, because you see how busy they are. You think your questions are insignificant. You're finding from here they're not, you know. You're finding from the outcome of your last pregnancy, they're not. No question is insignificant. But that also, too, you just don't get good answers when you ask. So you just may think that there's something wrong with you, and there isn't, you know. Okay. That's probably enough said about that, okay? And the K is to know your family history. Knowing what has gone on, not just for birth defects or those kinds of problems, but hi, how are you? But also too, what happened if you are in contact with somebody who can tell you this? What happened during your mom's pregnancy with you? Okay. Michael Liu, who is an educator in Los Angeles at UCLA, is doing a lot of research on the cellular level, because he really feels that that's where the answers are going to come to what are some of the causes of preterm labor that we don't know about. And it may be conditions that were set down for you when you were inside your mom. Okay, it may have been what your grandparents did, the line of your grandfather's work, and things that we're really looking at now as we're starting to get into the nitty-gritty. The only reason we can do that, is because of you. Because you've been involved with us and so on, and allows us to do that kind of research. But knowing your family history for birth outcomes is real important, because a lot of people won't tell you this until you have a preemie. And they go like, well, did you know? Did you know? Did you know? Did you know? It's like, no, I didn't know, you know? And
or even if people say it, though, you don't really you may take it in, but you're not going to be aware of it until it really happens to you. I mean, it's like, oh yeah, you know, so and so had this situation with.
Well, everybody tells you a horror story when
right,
you're pregnant.
right, and but it just kind of goes somewhere because it's not really relevant until you're living it. That's right. Yeah.
Right. That's right. It's true. And but knowing from a healthcare provider that, you know, this is important for you to go find that out. Okay. We have one person who has since left Preemies Today and gone down to Alabama, but she said, had she have known that her sister had preeclampsia and so did her mother, high blood pressure and pregnancy, she would have never put 2 ova into her uterus, because she ended up with 2 babies, double trouble, with pretty severe preeclampsia. Okay, so that's one instance where, you know, something like that it would be good to know. Okay, and I know that not everybody can talk to a relative. Relatives no longer available. We were adopted, you know, and so on. But it's real important. We have several people in my office that are adopted, but they actually have their birth records. So they know, at least from that they were born on time and so on. Okay, one of ours just found out from getting those records, that was one of the things I suggested that she do, that she was a twin. She didn't know that. So there's all kinds of interesting things that happened about that too. Okay. So now we've gotten kind of to the A's, and that's avoiding substances. Some of these substances are easy to talk about. Some of these substances are not easy to talk about. And I put down smoking and caffeine, drinking alcohol, over-the-counter meds, and the use of drugs that are street drugs. Right? These are things that need to be addressed in between a pregnancy. Because I know a lot of people will absolutely stop doing caffeine and smoking during pregnancy, but may pick up that again. What a powerful, powerful addiction that is. It is not a it is not a failure on your part if you smoke. But there is help out there should you need it, and especially for pregnant